Okay, you're ready.
All right, excellent. Thank you. Thank you, Lisa. And welcome, everyone. Lisa, if you could also save the chat because we'll be doing some in the chat, that would be helpful.
Yes, definitely.
All right. Okay, so welcome, everyone. I see this is a survivors group mostly. John is there, folks who help with the mapping, which I think was a tough thing to work on. Nasim, welcome. So maybe do a quick round around who's on, and then we can start. So today, let me see. Today we're going to talk about frameworks, feedback loops, iceberg model, boundaries. We have to create some boundaries and data gathering. So from now on, it'll be a little more traditional meeting, um, but we'll get to it. So anyway, so I'm Preeti Irani. I'm a member of the task force. If you could just introduce your name, and if you're a member of the task force, just let us know. Margaret, you want to go next?
Oh, Margaret Brennan, and I'm not a member. I'm a member of this committee.
Great. John?
My name is John Lemelin. Hello, everyone. And I am on the task force and this committee.
Okay. And Dustin? Dustin, do you want to introduce yourself?
Yeah, sorry, I hit the wrong button. I'm Dustin. I am not on the task force, but I am in this group.
Rita?
Hello, I am Rita Ogren McCall. I am not on the task force, but I'm on this work group.
Jody?
Hello, I'm Jody Lovegrove. Same, I'm a member of this group, but not the task force.
And Nasim?
Hi everyone, I'm Nasim. I'm not sure I'm a member of task force, but just member of this group, I think.
Yes, that's right, Nasim. So we have two of us who are members of the task force, which is fine. And we may get Liz who will join in. But any case, so there's a lot to cover today, but I'm hoping to give enough time for discussion. And so our activity is, and I had that up, so I'm going to just share the screen. If I share the screen, I can't chat, which is okay. So let me see. What I would like you to do is go, do you know where your chat function is on your screen? So let me show you whether it's on the top, at least on my screen. If I share my screen, I see. That little kind of box with those squares in the middle, that's my chat function. If I press it, I get to see the chat. So if you could chat in your, put in the chat, and I'll tell you that if we stand tall, it's because we stand on the shoulders of many ancestors. This is an African proverb. In the chat, please write whose shoulders you stand on. And I'll just put the question there. Just give you a minute to write. All right, so I'm just going to read. Dustin says, my parents. John Lemelin says, so many people, starting with my parents and teachers. Margaret says, the members of my mother and farthest families, they were strong people and leaders for change. Rita says, my strong parents and grandparents. Jody says, family, older generations. Nasim says, Sarah Bundy. Me, I say my mother, lots of writers. Currently, I think Donella Meadows is kind of following her very closely. My relatives in India, the Hodana Soniga. I'm on here in a land in India. I didn't really have a place to live, and here I have a beautiful place to live. So just, so many people. So that's just kind of to remember all the connections. But thank you for responding. So what I'll do, I get a little confused with all my screens. I have 3 screens. And the presentation I want never shows up on the screen that I want it to show up in. So I'm going to try again. Let's see. Where is my mouse? There it is. Sorry. Here we are. All right. So now what we'll do today is, I'm going to present now though. Present your entire screen. And I think this is a better screen to present in because that's where it was showing up. Let me try. Okay, so like I said, I'll talk a little bit. I have asked Rita if she would help me co-facilitate a part of it because she actually has more experience in systems thinking than I do. And so that was great. It's always good to have someone with a little more experience to lean on. So most of you on this call were part of that group that worked on developing a shared understanding. That was a really tough exercise. Rita is going to do the iceberg model. Then we'll focus on prioritization and the data template. And for the next 3 meetings, at least, we'll be talking about data and best practices. It'll be a more traditional meeting than what we have. Ground rules are the same, which you've gone to. We've got to trust each other and trust that we have good intentions. We connect, maintain an open dialogue, just try and figure out what the other person is saying. And if anybody says something offensive, gently try and bring it up. Speak up, though. Respect each other, be intentionally inclusive. We are co-creating. So you see, every time we have a meeting at the end, we plan the agenda for the next meeting. And part of what we do with systems thinking is look at the big picture and how the different parts are connected. So we have been, for the past 2 meetings, focusing on developing this shared understanding. And now we'll really talk about data and frameworks. We'll probably touch on all of those that are listed, but the ones that are highlighted is what we'll focus on today. And here are some quotes that kind of sum up what we're doing. One is by Rumi, the Sufi poet. There's a voice that doesn't use words. Listen. And this kind of resounded because that's what we're trying to listen to, the system. And it's very hard. If you don't really look and sit quietly and watch, it's hard to hear it. And then there's Fred Hampton, who was assassinated when he was 21 years old. You don't fight racism with racism. You fight racism with solidarity. So having said that, we have to kind of find the bridges that help us build this solidarity too. So to do that, we had introduced in the past meeting, we talked about our strengths, and we talked about 2 frameworks. One is systems, dynamics, and thinking. Basically, racial equity and justice is a complex issue, and complex systems means it has interconnecting parts, their own properties, behaviors, and terminology. And the relationship between these parts are emergent, spontaneous, adaptive, responsive to feedback loops, and not linear. And the other was the well-being framework. And really the main thing over here is that well-being and resilience is influenced by quality of life and material conditions. And to really kind of enable well-being, you have to look at these 4 buckets of assets: natural, economic, human, and social. So between our last meeting and this, most of you were involved in developing the shared understanding mapping and identifying feedback loops. A third framework that I want to propose is targeted universalism, which means we'll be setting universal goals, but pursued by targeted processes to achieve those goals. So we'll be looking at specific groups. How are they what is their status, or how are they affected towards meeting each of those goals? And accordingly, our strategies will be different based on the different groups, structures, and culture. So this was suggested by John A. Powell. That's the word he coined. And he's out of Berkeley with the Othering and Belonging Institute. And so why am I talking about these frameworks? So if you think of us, we're kind of building an ecosystem, right? We're trying to grow a kind of a community that we want. So when we want to make decisions, like frameworks are like mycelium, they communicate everything that we do. So the three frameworks that we will be part of everything we do will be systems thinking, the well-being, and the targeted universalism. And the next layer up, you see, we'll be looking at partners, public, private, nonprofit, and civil society partners. And then above that is the process that is generic. I mean, everybody does. You try to understand what it is. You raise questions, you understand what you're doing. You try to raise questions, you assess, you review, you prioritize, you define, you identify policies, you implement, evaluate, and continue the cycle. And you hope what emerges is some very healthy growth. So that's really what what the frameworks are for. They're below the surface. Oops. You can see my screen, right? Yes? I've been talking. Yeah, I hope. All right, so then, trying to see. Okay, so these are some assumptions we are working on. So let me know if these are correct. That racial equity and justice are complex systemic issues. So again, the properties of complex system. To strengthen racial equity and justice, we must know how system changes create an ecosystem that would enable change and status of our community systems. And every community member has the power to strengthen racial equity and justice. If we work on under the wrong assumptions, we are not going to make change. So really think about what we're taking for granted. And this is where at least where I see we're coming from. This is what you worked on last time, right? Or we said what is connected, what causes, what are the influencing factors for racial equity and justice. And then what we did in our subgroup is develop groupings. We looked at the well-being model, so those little lines you drew, which some of it is social, the extreme right, and some of it is there's very big social. Some may be infrastructure like housing. We didn't talk so much about natural resources, soil, air, water, but those are some of the discussions we had. And what I was interested in is like looking at the feedback loops, because that's where we get leverage to move systems. So that's where it was a hard exercise. And it was like, I always wonder when to do this. So I did this in the beginning, and what we're going to do, and I'll explain one of the loops. I won't go through all of them, because what we're going to do with that is keep it. We kind of have prepared the ground, and we're going to keep it and watch it while we continue our data and best practice discussions, and look at it every now and then, but again, revisit it in maybe October and see what our discussions added to it, or what our discussions confirmed or did not confirm. So again, I have to say this was really hard work. So thank you to Dustin, Jody, Liz, Margaret, me, Rita, Sabrina for contributing to these efforts, and for Lisa, who patiently worked on the technology. I'm relatively new at using systems thinking, and since I envision this will be part of a report, I asked a UAlbany professor just about causal loops because I had some questions. So if anybody, there's no wrong way to do it, but but I just want to, the editing part can be tricky. So I just wanted to ask him. So if anybody wants to be part of that discussion, let me know. Like I said, we may not have time to go over all the feedback loops in this meeting, but I'm open to doing so at a separate meeting. And this narrative has been posted, but like I said, it's just the start. It's like our basis, and it will change as we talk. And I have put some examples, local examples of how you apply this of local systems in the resources folder in the shared drive. One of them, Rita actually brought to my notice that TU had a number of articles about Albany. And it was very, very kind of had the system's structures described. And if you want, we can have a separate discussion. Even with the loops, we may not have time today, but if you really want to understand them, I'm open to having a separate meeting. So when you look at the loops, we'll probably talk about one or two at the most. Is positive, you see a plus sign, that means a factor influences in the same direction. Negative means in the opposite direction. Feedback loops are circular pathways, which reactions affect themselves. So I'll explain in a minute. Reinforcing loops are they amplify the system. So contractions, women who go into childbirth, as the contractions increase, more likely you're closer to giving birth. Balancing loops stabilize or dampen the system, like regulation of body temperature. How our body makes sure our kind of gets feedback to the brain so it stays at the constant temperature. So that's called balancing. Balancing groups can be good, or it can slow you down. So here, one of the first things Liz actually said at the first meeting was, how do you feel when somebody says, leave the country? So we started with that, is when somebody says, leave the country, you don't feel you belong. So for belonging, if you start with that particular part of the feedback loop, that is strengthened if you have nurturing relationships. And nurturing relationships are strengthened by meaningful interactions, right? So belonging, one of the terms people had often had said, I think it was Sabrina who said that people sometimes say, kind of make people feel different because there is zero-sum thinking. And what is zero-sum thinking? Zero-sum thinking is if this person gets something, then I lose. That's zero-sum thinking. That if this person wins, I lose. So belonging actually decreases zero-sum thinking. But zero-sum thinking is actually should decrease interaction. So here, see, so basically what this is saying is that nurturing relationships, meaningful discussions, interactions, increasing nurturing relationships, and decrease zero-sum thinking. At the same time, what increases interactions is inclusive spaces. So you can see it's a little complicated. So that's why people's minds, well, even mine was kind of a little burnt up. So I'm just going to stop for a minute and going to just see if people kind of got a sense of what I was talking about. Oh, there's Liz, you're there. Okay. So you get a sense? Basically, what we're doing is, and everybody will be quiet because even when we were doing it, it was a lot. We were doing it virtually, first of all. This is best done in person with sticky notes. So basically, you have to say is, what helps belonging? Interactive spaces, when you have meaningful interaction, it helps belonging, right? You agree with that? Nurturing relationships help belonging. And why that feeling of belonging? And what doesn't help belonging? I'm going to let you go, whoever wants to say. What doesn't help belonging? Yeah, Liz, you're on mute though.
Okay, so belonging means you are acknowledged, your presence is acknowledged by others.
Mm-hmm. Right.
That's one thought. But again, we are talking about the inclusiveness, racial equality. Your voice has to be heard. You have to give some time. Someone has to give you some time to talk, and
Right.
voice has to be heard.
So basically, you're saying you have to have that interaction. That's why the pandemic was so challenging, right?
Right.
Because we didn't have that place to meet. We have to learn technology, which is tricky. So don't break your head too much about it, but it's what I shared. So every time you talk, I'm looking at this map and I'm always correcting it because I do get lost in it as well. And I will not spend too much time on it, but that's what it is. So basically, what this gives us an idea is belonging, a sense of being heard is important for our group, right? It makes people feel valued. That is one data point we should be looking at. On the other hand, we should also look when whatever intervention we're doing, that people do not feel like they're losing, which is a big part, that resentment. You want to capture that too. If there's an intervention and people are feeling resentful about it because they feel they are losing out or they're losing their opportunity, that's important to figure out too. And the reason I say that, I don't know if any of you have read this book by Heather McKee called The Sum of Us. Anybody heard of the book, The Sum of Us? And it's a very good book. It's very well researched. Basically, she says a lot of times there's a lot of resentment. And that is one big reason for the racism and the opposition, because people feel they're losing out if you give one group of people something. And research has shown that is not right. It doesn't show up actually. So we have to show that the benefits are shared. It's not only benefits one person, it benefits us all. So really, this is what we're trying to get there. So this, everybody was lost and everybody is still lost. Don't worry about it. By October, if you're still lost, let me know. Okay, you'll get there. So I am not going to answer. If you want to talk about this some more, let me know. We talked about affordable housing, jobs, education and older adults, public safety and participative governance. Some we talked about. This is what actually the entire shared understanding map looked like. And Dustin, I think, and I don't have your quote here, Dustin, and Sabrina, all of them said that this felt very forced, which is true because I was trying to figure out, should I do it in the middle? Should I do it in the beginning? It makes better sense to do it in the beginning because you can apply it now and see how it works out. But there's much missing: addiction, access to care, disparities, community investments, clean water, jobs of the future. There's a lot missing. And we can't have everything because I don't know if you've seen that famous map that Army did of Afghanistan. It looked like a big spaghetti thing. It's really hard to read. So we need to prioritize. So what are our boundaries? So one of the things, we'll identify our boundaries, but I'll give Rita the floor now to talk about another model. So keep that mapping aside for a minute till October. We'll get back there. But now let's talk about, this is a much nicer tool. So Rita, I'll hand it over to you.
Okay. Hello, everyone. The iceberg model, we did see it before, but we have one here that's filled in. And what I used was an article, and I should have had the article sent over to everyone. I apologize. But it was an article in The Nation, and it was programs that work from within to prevent Black maternal deaths. Workers target root cause, which they target as racism. That there, New York State, if you look at the top, our event, okay, is something that we can see, something that is manageable, as far as something tactile you can hold on to. And New York State gives us these rates. In New York State, the Black mortality rate for Black women was 51.6 deaths per 100,000 live births, compared to 15.9 deaths per 100,000 live births for white women. And this is during the period of 2014 to 2016. Okay, the event is what we witness. A good example of this is the news article, because we read about an event and we may recognize some of the patterns, occurrences over time, things that lie at the surface. They come to mind when we see things like this. Okay. But one of the aims of systems thinking is to discover what patterns, structures, and modes of thinking, which is our mental model, that lies down deep beneath. In this example of this event, okay, we also see the numbers, or the numbers for New York State are more hopeful now because of intervention. Okay, now at 2017, I just looked them up, is 48.4 for Black women versus 14.7 for white women. But still, that's too high, any death, but this is across New York State. Okay, these deaths are occurring during pregnancy up to 42 days after delivery. Okay, some of these, I'm going to just give you a little bit of context of why this is so critical. Okay, from the New York State Task Force, what they're working on, what they're seeing between 2012 and 2014, the top 5 causes of pregnancy-related deaths were embolisms, hemorrhage, infections, cardiomyopathy, and hypertensive-related disorders. Now, we can point to a lot, and we can say it's all these other things. But from what we understand, we also see that education is not a solution, not an immediate solution. Okay. And what we're talking about is also a study on severe maternal mortality, which is SMM. Morbidity. Okay, and that is the occurrence of these instances like hemorrhaging and all of these other things that happen, during pregnancy. We're talking about during the birthing, and afterwards. Okay, and all of these occur, okay, and they're found in Black women with a college degree had a higher SMM rate than women of other races and ethnicities who never graduated high school. So, that's something that we have to look at also. So what is causing these things? And, we look at things, and I'm sure a lot of things can jump to our mind, and we're going to throw some of these things out, and when we start looking at specifically at structure and the mental models. Okay, so what patterns are we, can we see? Okay, one of the patterns that we came across was, despite policy changes, such as hospital protocols, there's still racial gaps. Okay, they still persist. And we must also consider that racism fuels power imbalances that create barriers to healthcare and other institutions beneficial to women's health and stability during pregnancy. The iceberg model tells us that the events and patterns are always rooted in the systems, guided by beliefs of those within the systems. The structure drives patterns of behavior over time through feedback processes, delays, and other relationships that can be mapped using our causal loop diagrams. So this is why we use the causal loop diagrams, because we're able to actually detect and model these relationships. This is used by a lot of professionals who study cultures and cultural studies. As we turn our attention to the structure system, the system structure, we have added first, medical questionnaires often ask for race, and they often ask for race and history of present illness, which reinforce the provider's bias. The implicit biases guide the possible diagnosis before the examination begins. Because you have to consider, also, while you're in the office, you notice you're brought into the room, and an associate comes in, either a nurse or an assistant comes in, and they'll question you, they'll take your weight and everything. But meanwhile, this doctor, he sees what on his chart? Your past history or present illness. He'll also notice your race. Now, unconsciously, okay, he's arriving at a diagnosis. It could be this, this, and this. There are the go-tos, especially when it considers race. Okay, so the one of the suggestions was to eliminate those from the charts. Okay, unlike events and patterns, structure is a hidden network of relationships that create or stimulate behavior. Mental models, however, are deeper attitudes. They are way at the bottom. Okay, these are deeper assumptions, behaviors based on experiences, perceptions, and the understanding of the world. They are responses to a person's understanding of other people's motivations and thought processes, depending on the landscape, where you are, what you're working with, and also their values. But a lot of times these are not apparent when we are in the act of doing. You see, this also was one thing I really loved when Pretty was talking about belonging, because those also affect our perception of belonging, who belongs and who does not. Okay, so now the addition to system structure considered, all right, and this is something that one of the things that we're considering. We're going to explore others, but in the article they were talking about a system set up to mediate the what's going on in the doctor and what's going on in the patient, the relationships between the two. And what they came up with, and this is used, okay, they came up with, doulas that are trained, community organizations, and they train doulas. They, and they train about reproductive care. They also have 100-hour community healthcare worker courses. They have Medicare coverage to pay for these, and midwifery systems, and they're being implemented in organizations to strengthen, the cultural competency between the medical care system and the community. Let's see. Okay. Yeah. The system is considered community-based systems ensure cultural competency. Cultural competent communications between the client and the healthcare community. All right, doulas are trained non-medical care workers, providing counseling, physical comfort to mothers, and emotional support to the mothers and the family before, during, and even after the birthing. They come to your home, they make sure that if any questions that you have, they can answer, maybe make suggestions, as far as like exercises and other things that they have learned and they have studied. And they go through a lot of training also. Okay, let's see. Midwives, okay, are clinical workers translating for both the client and the healthcare process, exemplified in the mental model. Because we're going to look down at our mental model, and the mental models existing between the healthcare worker and the patients can form as such: lack of understanding. If I reach out to the communities for input, I get burdened down with different suggestions that are contradictory. It is easier to work with organizations. Or you can get a Black patient who feels historically devalued. Why does the doctor disregard what I'm saying when they ask questions? You don't know what they're giving you. Okay, each can be mediated by community-based intervention. As we think through our iceberg model, what structures might explain the patterns where other mental models are present? And just think about this. And what other structures are necessary to achieve a positive outcome? Okay, so let's go over our iceberg model, and we'll go back to events. Okay, what is the crisis highlighted in these events? And you can use expressions to start off as I think that, or I believe that, or I know that, because nothing that you're saying is wrong. Okay, these are all the things that come into play every time we approach a situation. All right, so who wants to begin? Go ahead.
Rita, may I
Yes?
interrupt? Oops, oh God, an echo. Okay, so the events, you're getting the echo? Okay, so the events, now this is for our racial equity and justice, okay? In Niskayuna, if you prefer, or New York, or wherever you are, you're thinking, but in a context, so let's say Niskayuna, what are some events that kind of bring to mind that brought about the task force that that brought it to our attention, racial equity and justice. Now, this is what Rita gave you was an example in maternal mortality. But what kind of events are in Niskayuna that kind of bring this to light? For example, we had at a football game some students using kind of disrespectful language, right? At students at Schenectady. That was one, right? We've had some events in Niskayuna which brought about the need for a racial justice and task force. So if you could just tell us what are some events that we see in Niskayuna?
People being pulled over just because they're of their color
Okay.
by law enforcement.
What else?
Well, I had a friend who used to run. He ran when he moved here, and every time he'd run around Rosendale Estates, somebody would call the police, and the police would come and want to know what he was doing in that neighborhood and all that. And he said he had to make sure he had ID on him, and he had to sit his son down, who was also a star on the track team, and tell him, you know, you got to carry identification because you're going to get pulled over.
This is a black man?
Yep.
Okay. Anybody else?
Preeti,
Yeah.
this list again. Because one of the same instance what happened to me also happened to one of Niskayuna resident. Because one of my teachers mentioned that they pull over to the front of the house and mention the same wordings I mentioned, I put on the chat. So it happens to, again, in my neighborhood, my neighbors told me he wants to burn my house, then I'll be done. So,
Yeah.
so things will happen again, you know, in school systems, because my children suffer a lot of disparities. So I don't want to specifically mention that, but a lot of events happens in the sports field.
Mm-hmm. Now, could somebody read the chat because I can't see the chat? Someone read the chat, but I don't know what Liz wrote.
Oh, no, Preeti, the chat
Oh.
I wrote it like before the beginning.
Okay, beginning. All right.
I didn't.
What else? It can be positive, but what are some events related to racial equity and justice in Niskayuna? We had the blackface incident, right? At town hall.
Yes.
Mm-hmm. And all the conversation around it. What else? What other events?
Positive events might be several BLM rallies held around town.
Mm-hmm. Okay.
We have a family that moved in our neighborhood. They're a Black family from Lansingburg. And the son loves basketball. And I was talking to him one day and I said, how's it going? Are you on the high school team? And he said, I was, but I quit. And I said, why'd you quit? And he said, because he was being picked on in ways that the other kids weren't being picked on by the coach. And he decided he just wasn't going to put up with it anymore, so he quit.
Okay. All right. So this is some we can add, we can come back to it. So what are some patterns we see? You know, we've seen several incidents. What are some patterns?
It's a continuous process, really. So they pick on some group of people. It doesn't have to be rich or poor, but maybe it's a mood of that person. So you just pick on someone so they can bully that person.
Mood of person. That's a question mark, Liz.
It's a bullying,
Yeah.
pattern.
All right. So, but pattern is sometimes it seems like nothing, people talk about it, but nothing gets done. Talk about it, but nothing substantial.
So a pattern I see in many of these examples is that the specific action in the moment might be defensible as this could have happened to anyone,
Mm-hmm.
but the pattern of many of these events
Mm-hmm.
suggests that it doesn't happen to anyone.
Mm-hmm.
So any student could be bullied, or anyone could be pulled over by law enforcement, but the pattern of who is pulled over multiple occurrences is significant. And that makes it very difficult to pick a specific incident and say that this is what happened here, that this was a pulled over because of race.
Makes it difficult to defend, would you say? Is that what you said? If there is a single action, then it's defensible, but there are multiple occurrences. It's hard.
I think, let me figure out how to say this. It's easier to defend a specific incident
Mm-hmm.
for an officer, for some of these examples for an
Mm-hmm.
officer, but the pattern makes it, but it's harder to defend the pattern.
Mm-hmm. Okay. All right, good.
Yeah, because that was the situation with the picture, the blackface picture. I was one of the people who received other emails that had been sent from the town computer by the same person that were absolutely disgustingly racist. And they were over a period of time.
Mm-hmm.
And nothing was done about it.
Right. Okay, let's go to systems. And this is never done, okay? We keep looking at it, and as people discuss, we'll add more. The systems is, for example, it's sometimes when you cannot count. For example, when I was looking at the police reform report, I noticed how difficult it was to get data about what was actually happening. And the reason was it sounded like there was no systematic way of collecting this information. There was one person who volunteered at the police department to do this information. And so I asked the consultant, I said, how did you get this data? They said it's mostly pencil and paper, and there's no uniform gathering up this data across police departments either. Each one does it in their own way. So if you're trying to look at multiple occurrences, it doesn't seem like it's systematic. So data. My thing is data collection is not a priority, it seems like. So then it's hard to kind of make a case one way or the other.
I agree with that, and maybe the flip side of that is that no one's specifically responsible for
Right.
the patterns. A
Yeah.
person can be responsible for an incident, but no one's specifically on the hook for a pattern of behavior over time.
Pretty, I don't know if this works, but could it be that there, like you said, it's a lack of data. It's also a lack of oversight, lack of independent oversight or community oversight
Yeah.
that could step back from the
Mhm.
specific transactions and help identify a pattern.
Mm-hmm. Okay, I'm going to go to mental models. We can come back, and like I said, this is not the end. But the part that always fascinates me is this mental models. You know, how people think, because that really influences. So, for example, um, I do hear people say, "You're making a big deal out of something, even though it happened to me, nobody would make a deal. But this is you're making a big deal out of nothing." You know. So it kind of leads back to people see this as like occurrences that happen because of the mood of a person, that happened once here and there.
I might be saying the same thing you just said, but maybe not. Someone who doesn't encounter these incidents repeatedly themselves, or the people that they know, doesn't see the patterns. And I think that those people who aren't encountering these events on their own.
Someone who does not, could you repeat that again, please?
Yeah, it's hard to come up with a sentence and make it succinct at the same time. I'm sorry. The people who don't experience this don't see the patterns.
Okay.
And I think that's the mental model is just not, the mental model is that there isn't a pattern. So that's why I think it's the same thing you just said, but maybe a different way of looking at it.
No, that's good. No. Rita, you've been quiet.
One that I've experienced, that I've seen a few times, is that the person that's being accosted, they're switched as aggressor instead of victim. And no matter what they do at that moment, they're the aggressor.
Mm-hmm. Right. Another one I've had is we had somebody work at our house, a contractor, a white contractor. And he said, look, I have to struggle. And he was a white contractor. I have to struggle to get a job. But look, if you're a black person, you go to the state and you get a job. So that's where I first experienced zero-sum thinking, because the at least the perception was, if you're a white person, you cannot get a good contract at the state.
Preeti, that's the way of thinking, that person's perception about
Yeah.
a job. Maybe, it's a statement. We always hear that if we get a handyman also. They always say that too. But again, I don't know how the employment status are because I'm not working anymore. Yeah, sometimes it hurts the way they don't realize, we as a other racial or diverse community, because of the way they learn how to talk, maybe the ignorance, lack of education, the way they stating that statement. I don't know.
It's no, it's a thinking. It's the resentment. Actually, there was this famous study. It was about 4 years ago. It was Anne, forget what, Cash and Angus Deaton out of Princeton. They found that the death rate in the United States, which had been going down, suddenly went up. Mortality rate it went up for 3 years in a row suddenly. And the rate went up because it was the white men who were actually increased mortality. And they found that it was due to what they call feelings of hopelessness. So suicides, opioids. And part of this people who studied this felt that white men, a lot of white people felt they were losing status, social status. But then with the pandemic, of course, the rates are now again crazy. There have been increased deaths. So now I don't know how it's, definitely there are deaths because of the pandemic. But the feeling of resentment that you're losing out is well documented.
I wanted to share some things along these lines. I think that also, if we look at this Cayuna demographically, we are a cultural diverse population now. We have a little bit of everything here. I don't know if any of you have ever heard of Oscar Lewis, which touches upon the cultural poverty. And what we are seeing a lot of it is this type of mentality that it gets confused sometimes with race, right? And the opportunities you have sometimes because of that skin color. So what happens is that, for instance, many people, and I want to put people in general in this situation, are misconcepting the part of like class with race. You have these opportunities and certain values and certain norms, cultural norms that you are bringing in within yourself, and that gives you the doors to open certain opportunities too, right? So if you already have if you have been already in a marginalized family or structure, most likely you're going to be continue that domino effect. This is kind of like a pattern that we are seeing, right? Mm-hmm. So many people have this excuse that saying, no, I have to really work hard to get to where I am today. But what we're not looking at is that part of like, okay, well, class, economic status, education, all of that conforms to where you are at today. Now, having that added to the component of having a different skin color makes these opportunities much more either wider or narrower. And that's where there is a friction of understanding how you are actually inserting or interrelating with society. Now, Niskayuna has, again, a very well structured demographics with cultural diversity. I think that part of it is also the civility and how we understand one another here in our town has been decreasing how we interact and respect each other. I can give you a very simple example. To my standards, I will not say to a stranger, hey, I will say hi. I will be try to be very polite towards that stranger. But here, like when you interact with someone, they say, hey, and in many places that could be acceptable, especially if that person is your friend. But if this is not your friend, hate is not acceptable. At
Hey,
least to me.
Ari, that brings me up. You had a similar experience, Rita, right? I remember you was telling me about how people addressed Black people differently. Did you, Rita, are you on?
You're
Like,
muted.
Well, one of the things, like you were saying about Niskayuna. Niskayuna is not in a silo, but in general, I think that people conflate class and race.
Yeah.
Because when they meet a Black person, you're automatically in a class.
Mm-hmm.
And this happened, and I'm making short, this happened to one of my professors at UAlbany. She lived in Old Niskayuna. And she came into class one day distressed because she was accosted while taking her baby to the babysitter here in Niskayuna. The woman came up to her and asked her, was she the nanny?
Oh, wow.
Okay. Now her child is the same complexion she is. Okay. So, and then when she just, I guess what in her confusion, she stalled and the woman became more aggressive. You see, now the thing is, and through this whole thing, I mean, she's a professional, she composed herself and everything else, but what came out of it, because we discussed this in class, and the thing is, it wasn't as if she was looking for a nanny, it was abuse. You see, and yes, and I mean, if everyone goes there every day to take their child to the same babysitter, of course you've seen this woman before.
Yeah.
yeah, there was another story, Rita, you mentioned, which reminded me of what Ari said about hey and hi. That when you were at the supermarket, people greeted white people differently and Black
Yes.
people different. What is that one?
And I made it a point. No, I made it a point to look up. It's excuse me.
Right.
And I started writing about this because I found it odd. Well, see, I came from a big city, and people are busy. They will say excuse me to get by. Okay, and because they want to get where they're going. But I notice here in the stores and thing and such, they have room or whatever, but they will stand there and you can see them puffing up. They want you to jump out of their way. They will not say, excuse me. And all they had to say was, excuse me. So I took some time. I looked it up first online to make sure that I was correct and that this should be universal, at least here. And then I started shopping. And I realized that what they will do is when it's a white person, they will say, excuse me, or pardon me. I would like to get by, right? But if it's a dark-skinned person, they'll stand there and puff up and carry on. I mean, and not say anything. They'll just, you will turn around and you will see this person actually angry at you. And you're trying to figure out, first of all, you're trying to figure out why, and then you realize they want to get by. So, it's a thing. But so what I started doing was, the reason why this is important, especially when we're talking about people of color who are already trying to fit into situations and they shouldn't have to, it should belong, is that you tend to always, just accommodate this behavior.
Yeah.
You see, and your body naturally does it. It's no longer a thing where you're doing it, just trying to keep peace. You already get programmed to doing that. And that's why I started realizing about, excuse me, that I started apologizing. I saw this the other day too. Somebody said the same thing. I was, oh, wait a minute. I know where it is and you can see it. I don't know if you saw In the Heights.
Yeah, I mean, I thought about it.
Do you remember that part about Stanford when she was saying the woman accused her of stealing her daughter's pearls? And she wanted to quit college because the woman stripped her stuff down, searched all her things, searched her bags and everything, and they found the pearls in her daughter's bag, right? But what the young lady who was being abused, what she ended up doing was, after it was all over, she ended up apologizing. See?
Yeah.
That's right. So we too, it's not become, I don't know, sorry, I don't want to be prolong this, but it's not becoming overly aggressive because you don't want to become that person.
Mhm.
You never want to become that person. But the thing is, you have to also remember that your body, all this tension that you're carrying in your body, you have to let it go. Anyway, I'm done.
No. Thank you. Thank you all for doing this. I'm going to write this up neatly, the spelling errors, which is fine. But really, the structure, system structures and mental models are hard to see, and this is what it is about. So we'll keep this here, and I am going to see. Oh gosh. Sometimes I get lost with my screens. Where is it?
Or like another good example too is like, for instance, when people have accents too, that combined with race, people don't want to listen to you.
Yeah.
They don't want to, and in that they start like screaming at you like in something that you're not understanding well English enough. Hello, yeah, can you understand me? Comprende? And it's like, wait a second, I do understand you don't have to raise your voice to make your point. And if you take just a little bit of time to listen to what I have to say, then you might be able to understand the situation that I'm going through. But it's again like a hopelessness, desperation kind of situation where you have to pull that accent in order for people to understand what you want to say, right?
Yeah.
Which
Yeah.
happens
Yeah.
a lot.
I just have something I'd like to add too about that, because Niskayuna has changed hugely in the last 20 years. I've been here 43 years, and when I came here, there were very few anybody who wasn't white in the schools. And the biggest problem we had when we moved here, because I just bought a house because it was nearer to where my husband worked, and I knew nothing about Niskayuna. And this is the dumbest thing that could happen, but I moved here and somebody said, there's a PTO meeting tonight, a special one. Why don't you come with me? Because our kids went to Rosendale because Birchwood was something else in those days. And so I went to this meeting and there was a woman there, one of the queens of Rosendale Estates. And she basically, when she asked me where I lived, and I said, across Route 7 off of Leishakill Road, she literally went, huh, and turned her back on me and never spoke to me again for the 12 years our daughters were in school together, because I lived on the wrong side of Route 7. And now things are changing so that people with that same mentality, I moved here because I'm the elite, no offense to any of you, but the lawyer, the doctor, the scientist, the whatevers, and I want to live in this neighborhood. And then when the scientists started not all being white, and the lawyers started being not all black, all white, lawyers became black, doctors were all different colors and from different places all over the world. We have in 20 years become a really incredibly beautifully diverse community. But I think there's still people who live here who haven't adapted.
Oh, yeah.
And I think mentally it's a strain on them.
Okay, I'm going to move us along. This is a good discussion. We'll keep this, we can keep adding to it, but let me go on to the next one slide here. Oh. Okay, so, but really, what we really want to look at is system structures and mental models. So I'll send this out. Feel free to add, as we go on, but I wanted to kind of move us to thinking about data because that's what and best practices. That's what we'll do for the next 3 meetings. So The focus area, so I wanted to suggest some criteria. When I say proposed, means it's up for discussion and we'll decide at the next meeting. That the town has a significant clear role. By that I mean, if we're talking about schools and issue, the town may not have kind of the jurisdiction or primary oversight over teaching, but they may have other roles. So we need to identify it. We need One of the ideas is to develop some kind of a dashboard which we can get a sense of whether we're moving in the right direction. So we need data for that, and good data. And so we do not have the resources to do a really good study, but there are lots of resources. So I'm hoping the data that we look at will be available at least at the county level. It'd be great if it's at lower level, but those are sometimes harder, some of them maybe, or at least regional and state levels. And focus areas, I was thinking between 3 and 5 because it gets unmanageable otherwise. With interventions, the priorities I was going to propose is efficacy, that it's shown in some way, there's some back research or some literature or some consensus that this is a good way to go. Impactful, it'll make a significant positive contribution, and it's feasible, that there's will, and capacity to do it. We'll be able to do something about it. This is something for you to think about. We talked about what kind of data. Right now, when I talk about the dashboard, we're looking at mostly secondary data. That is data from census, a lot of data is available from health, from education, existing planning reports, and their policies for what's already happening. But one of our activities will define, based on our priorities, what data to collect. And we will set some baseline, if we can, and targets. So here's racial equity and justice. Jody, I know you've been busy in the definitions, and there's several definitions if you look at the shared site. So I took a couple. Racial equity, the definition: just and fair inclusion into a society in which all people immaterial of their race or ethnicity can participate, prosper, and reach their full potential. That comes from Policy Link, a pretty respected name. Participate, prosper, so you're talking about opportunities. And then social justice is a society in which distribution of resources is equitable and all members are physically and psychologically safe and secure, involving social actors who have a sense of their own agency, as well as a sense of social responsibility toward and with others and the society as a whole. And that comes from Theoretical Foundations of Social Justice Education, Northwestern University. So those are the two definitions. The racial equity definition I like because it's asset-based, it's positive. And so that kind of is keeping with this well-being, it's not a deficit definition, it's a positive definition. So based on those definitions, again, this is a proposed, I was suggesting, and this I adapted, saying I looked at several dashboards and equity dashboards, trying to see, what can we all kind of work around. So I did like the City of St. Louis equity dashboard, and so I adapted it. So suggestions I have to have like these 3 focus areas: well-being across the lifespan. So we look at all age groups, very young. I think the median age in Niskayuna is about 46. And then we have the older group. So look at all of them. Look at opportunities to thrive and justice for all. So under well-being, we look at well-being, education, inclusion. For opportunities, financial empowerment, neighborhood, health and safety. Again, I said these dashboards provide some guidance on what indicators they look at. And justice for all, policing and court reform, environment, and civic engagement. And like I said, we use our three frameworks: targeted universalism, well-being, and systems thinking. So this is basically the buckets. We have 3 focus areas, and we look at several indicators under them. This is all worksheets. So I have 2 worksheets on the shared drive. One is, for example, can you see this? It's kind of small, right? So let me see if I can make this bigger. Okay, so this is Like one worksheet has just said where the data is. So United Way has this pretty interesting, they call it ACID, basic working poor, asset limited income constrained employed. And they actually have it for Niskayuna. So that's why I gave it as an example. They basically pick this information for from census data. And so there are households who live below Alice household. So it's basically the working poor. And they have it for 3 years, and they have it for the state, county, region, and they do it for several states, and New York is one of the states they do that. So this is just what is there. They have for 2016, 2018, 2020. And then if I look at specifically Niskayuna, they have it for Schenectady, the county. So then I was thinking, so in terms of boundaries, it sometimes helps to compare Niskayuna to something, some standard, and there are standards for each of these indicators. So for now, while we're working on it, at least get Niskayuna County. I put city only because we work so closely with the city, we can decide whether we want to use it or not. But at least county, if you can get a region, New York State. So basically then what we would do is write the data here and come up with charts. So both these sheets are there. So let me just go on to the next and let me see. Then we'll keep it open for discussion. Oops, sorry. Let me zoom to fit again. Okay. Okay, so that was the last one. So I kind of threw a whole bunch of information at you. There are no decisions made, but this is for food for thought. Is first for you to think about the criteria, and we can talk about it at the next meeting. If something is not clear, we can ask. You can ask questions so you can clarify. We can talk about whether this, I mean, this is not set in stone. We can see how it goes, but have 3 focus areas, and there'll be several indicators. We do this for the state when we do health, and we look at a lot of indicators. But out of those indicators, we select a few which will really work. And that's what we'll end up doing. We'll see a lot of data, but we may select about 20, 25, maybe 10, 7 to 10 under each category that will be really helpful. And that's a conversation we'll be having in the next 3 months. So I'll be quiet and see if this is how you'd like to go. And if that is, then I would say pick one of these areas to work in, and and just let me know how you would like to proceed. My thought was I'll get in. I'd hope at least one of the task force members will be in each of these focus areas. So find out data and present. I know census data are pretty easy. So we definitely present census data at the next meeting, but maybe we can see what's available and present some of it at the next meeting. And pick one of these areas that you would like to learn more about and see what data are available. So once we do the data and we reach agreement on these areas, then we do the data, figure out what's available, what's not, and then go on and identify what are some best practices. So that's my thinking. So I'll be quiet and see if folks had questions. We have 15 minutes more, so it's open for discussion.
The other surveys that is very easy to manage the data is the American Community Survey. Village. That's, yeah, because this is conducted like every year, and so it's much more manageable.
Right, and that's where Alice is from. Yeah. Alice is part of the American Community Survey.
Who?
This data the United Way does.
Yeah.
That's taken from that's out of the working poor
database that you're okay.
So they tell you number of households. For example, their data is number of households before Alice threshold is 22%. Mm-hmm. Of 22% of Niskayuna residents have spent more than 30% of their income on housing, which is considered burdensome, while 59% in Schenectady do so. So there's tons of data, but any case, so my thought is, how would you like to proceed with sharing the data and researching data?
I'm wondering, would there be any value like to the communities that care survey that NCAP has done every other year since 2013?
It could be if it would come under, so this is it. These, you got to remember, these boundaries are pretty artificial. We're putting it. So something like that would come under well-being. We can take a look, like you said, but we'd have to come up with specific indicators. So I would
Yeah.
say, go to the city of St. Louis and see what kind of that's what I do basically. I look at what other people have used. And if you
Yeah.
would like, um, we could meet like 2 weeks from now and see what is gathered and then present it to the group, or you could send me information. How would you like to do it? Now, I know that three of us from the task force here, John, Liz, and me. So, and I'll be involved with every one of it. And I know there's Ari joined us, so there's four of us, right? So
I feel
Ari,
excluded.
yeah, no,
I'm
no,
just kidding. Just
no,
kidding. You're
because
marginalizing me, Brittany. Just kidding. Just kidding.
no, because we introduced ourselves early. So Ari, if at least one of us could be on each of these work groups. So Liz, is maybe you could be the one on well-being. John, do you have an interest in any one of these? To look deeply a little more in one of these?
I would probably do justice just because I
Justice
did so
for all.
much with policing.
Okay. And
Oh,
Ari, any
opportunity to try. Oh my gosh, that match us so well. This is so well.
all right. Okay. And all of you, just tell me which ones you want to look at. And what I would suggest is either you can, if you find interesting data, a link, you can either go to the drive and just fill it out. Fill out, is there basically the first one over here says, what's the data you're looking at? What kind of metric, households who live, what is the source? What is the link? Is town available, county available, region available, state available, national available? If you look at the resources on the shared website, I've been putting data sources in there. One of the hints I'll give you is the hospitals and local health departments in every county in New York State are required to do these assessments every 3 years. And the Healthy Capital District does it for the region. And Schenectady, I put a link out there. And so it's like taking a ready mix, because they've already put all these reports, and see what we can use. Because they already look at a lot of data. So that's a quick way to look at what have they already said and what's missing and what can we add. So I've put several links. Choose one of the areas to look deeply into, and just put, if you can either put just the data, maybe start there. What data are available? What do you see? What indicators? And we'll make a presentation on sharing what we find at the next July meeting. Is that all right?
Yeah.
Yeah. So maybe, if people are interested, whoever's doing this data study can fill in the information by July 6th or 7th at 6 p.m.
Wait, Preeti, July 4th is a long weekend, right?
Yeah. That's why the 6th is what day is the 6th?
That's a Tuesday. Isn't it?
I must have looked at a calendar. Tell me what data y'all are interested, which category you're interested in. Think about the priorities and see if they are something that seems to make sense. So 6th is a Tuesday, 7th is a Wednesday. So we could meet on 6th or 7th, 6 p.m., just see what people came up with. If you send me emails or put it in the draft folder, I can develop a draft presentation, and then maybe each of us can present parts of it. And in the meanwhile, watch what y'all are taking care of, because I'm interested. We never filled out what our roles will be in the role clarification sheet. So I want to make sure I kind of get an idea that each of us feels like we have a role, we're doing something. We could do to the July, August meeting. So is that all right? That we, at the next July meeting, will talk about the focus areas, if they make sense, the criteria, share our data. I'll ask you all, What role did y'all play? What did y'all do? And we'll see what data were there, what data are not there. Do they fit under the categories that are proposed? Because like I said, I didn't exactly take St. Louis's. St. Louis they tended to focus on youth. I thought for us it's important to focus across the lifespan because that is the way most of us work. And inclusion, I thought, is important because from what I'm hearing, that's an issue. And we may not find data on all of it. So then we need to say, oh, we didn't find data here. We didn't find data here. And then we look at our causal maps and say, hey, belonging and inclusion is important for us. So, how do we get the data there? So that's all the conversation down the road. But for now, just for July, is look at what data we find, present it, and what data we don't find. And agree on the criteria and the categories.
Are we going to do these in face-to-face meetings, or are we going to stay on Zoom?
I think I sent out a survey last time, and probably it doesn't matter. There was a preference for continuing the virtual meeting, but we could do the subgroup meetings in person because I think the town is going to open in July. Right, Lisa?
I thought they were opening this week.
Yes, they are opening this week. So that means everything in July, because we don't meet again till July. So yes, you guys have the option of booking this space if you want to.
So 6th or 7th. So what I was suggesting, one of the feedback I got when I did the survey is people felt having a virtual meeting allowed them to participate. So if they were traveling, they could still participate. And since I'm not doing Jamboards anymore, the only meeting I really wished we had in person was when I was doing the mapping, because that was really hard to do the mapping on virtual. But when we're doing the presentation, I think it's okay to do virtuals. But I can do a survey again and see if we could do the smaller group conversations, I thought, in person. But I don't want to lose people because people said that if they're traveling, it would be hard for them to participate. I can send out a poll again and see. Is that okay?
Yeah.
Yeah. All right.
That sounds good, Preeti. So
All right.
the Zoom, we can continue the Zoom meeting for a couple of months too.
Yeah.
We don't want to jump too fast.
Right. Okay. All right. So it's 7:24. Y'all were a great group. I know there was a ton of disparate information thrown. Like I said, everything we started is not done. We just opened up a lot of boxes, and all of them take a lot of thinking. Even the first two that I did, the causal mapping, which I blew everybody's mind, the iceberg, all of them cannot be done in one session. You have to think about it. So give us till October, because then we'll have a better idea. We'll have discussed so many issues. We'll know what data are there. We maybe will identify which ones we're going to use as indicators for Niskayuna, what targets we have, what's our baseline, or if you don't have a baseline, how are we going to collect it, and we're going to kind of develop a portfolio of things we want to do. Some may be things we are going to try, and some are proven to work, but we'll develop a portfolio. That's all at 7:25. And if anybody has anything else, any other questions or anything else to add?
Do you want to know which
Yeah,
committee we
go
want to
ahead.
be on?
Yeah, I'm going to stop sharing so I can see you all because I can't see anything. All right, here we are. All right, you can, tell me, since we have 5 minutes.
I'm not sure.
Okay, not sure. You can email me.
Elizabeth seems to be probably more in my
Liz,
area
okay.
of expertise.
Well-being, okay.
Well-being, yeah.
Okay. Others, any idea which ones you want to kind of do a deeper dive in? John is, I know, justice. You can even let me know. You don't have to let me know right now. Opportunities is Ari. Dustin, Rita, Jody.
Yeah, I was interested in the well-being one as well, but if you need But if you need
No.
to diversify things, I can be
No,
selected
no.
wherever you need me.
Jody, you be in well-being. That's fine.
Okay.
Dustin?
I think environment and policing and court reform both sound interesting. So
Okay.
justice for all, I suppose.
Okay. And Rita?
I was thinking about environment.
Okay. Yeah, she's an environment advocate. Yes. All right. And opportunities to thrive. Ari, I'll be with you too. Don't worry. You're not alone. And I see Sabrina's not in the group. Maybe we'll see. All right. So I'll send out about the meeting on the 6th and the 7th, figure out what's good. And email me and keep looking at the shared drive for information. All right. Thank you all. It was a great meeting, and we will talk again in July. Have a great week next month. Okay.
Thank you,
Bye.
Pretty. Thanks, Pretty.
Thank you.
Bye-bye.
Thank you. Bye.
Bye.
Thank you.
Woo. Rita.
Yes, Margaret. How are you?
Nice to meet you. You're on Dennis's committee.
Oh, yes.
History.
No, I'm off of that. I can't do any more committee. I can't walk.
Oh,
Oh, no. My legs are not working.
oh, that's not good.
Yeah, I know. It's sciatica, but I
Get out and
know.
walk.
Yeah, you can walk, but you can't drive. That's the thing.
Oh, that's terrible.
I know, and it started like I think April, something like that. Last year, April.
Ooh,
Yeah.
good.
So I was a diehard. I wouldn't give up my car until September. I kept it sitting there, but then I finally said, "Oh well."
Yeah.
That's it. I'll tell you, but it's fun. And listen, it's good to see you again, and I'll see you in a couple of weeks.
Good. You take care.
You too. Thank you.
Bye-bye.
Bye
Bye,
bye.
Lisa. Thanks.
Okay.